It is easy to overdose if we take various nutritional supplements for our health. Rather than be healthy, it can be harmful to our bodies. Let's look into the side effects of excessive intake of such nutrient. Fat soluble vitamins. Fat soluble vitamin A, D, E, and K. These are stored in the body's fat tissues, especially in the liver, and so they are not excreted in urine like other water soluble vitamins. As a result, they are likely to pose a higher risk of toxicity when consumed in large amounts over a long period. Primary symptoms of this overdose can be nausea, vomiting, diarrhea, headache, and any others. Vitamin A. Overdosing on vitamin A is probably well known for pregnant women. These vitamins, particularly from many supplements, can lead to a condition called hypervitaminosis A. Accumulated vitamin A may lead to blurred vision, hair loss, liver damage, and several severe symptoms like birth defect if consumed during pregnancy. Vitamin D. Vitamin D aids in calcium absorption, strengthens bones, and enhances immunity. In the sun, vitamin D is synthesized in the liver and kidneys. If overdosed, calcium and phosphorus levels rise excessively and may cause abnormalities in parathyroid gland. So, lots of vitamin D intake may link to hypercalcemia, a condition characterized by high levels of calcium in the blood. Typical symptoms are loss of appetite, vomiting, and muscle weakness. Symptoms may include frequent urination and, in severe cases, kidney damage and cardiovascular issues. The recommended daily dose of vitamin D is 400 to 800 international units. People with vitamin D levels below normal can take up to 1000. Vitamin E. High doses of vitamin E sometimes can interfere with blood clotting and increase the risk of bleeding, particularly in individuals already taking blood thinning medications. Water soluble vitamins. So excess amounts are typically excreted in urine. However, extremely high doses of water soluble vitamins, mainly through supplementation, can still cause adverse effects. For example, intake of much vitamin B6 can lead to nerve damage. In contrast, excessive intake of vitamin C can cause gastrointestinal upset and diarrhea. Vitamin C, an antioxidant nutrient, is known to be effective in preventing aging, relieving fatigue, and improving immunity. Because it is a water soluble vitamin, it is commonly discharged from the urine if you take an appropriate amount or more. However, diarrhea, nausea, and stomach cramps may occur if excessive vitamin C intake persists. A study also suggests kidney stone and urinary stone can occur. This is because components not discharged from the urine remain to produce these stones. The recommended amount of vitamin C is 100 mg per day. Calcium. Related with vitamin D intake, hypercalcemia should be a problem. Calcium is a nutrient that forms bones and teeth and is used for contraction and relaxation of blood vessels and nerve stimulation transmission. If it is not produced by the human body, an appropriate amount of calcium should be consumed daily. Too much calcium intake can cause angina, arteriosclerosis, and myocardial infarction as calcium debris build up in blood vessels. When taking calcium as a supplement, one-time intake should be kept below 500 mg. This will help the body absorb more quickly and reduce the risk of GI disorders as side effects. Iron. Iron is essential for producing hemoglobin, which transports oxygen throughout the body. Proper supplementation helps blood vessel health, muscle cell formation, and liver and brain function improvement. However, excessive intake can lead to vomiting, diarrhea, joint pain, gastrointestinal disorders, and bleeding. People with dizziness suspect anemia and often take iron nutritional supplements. Still, since dizziness occurs for various reasons other than anemia, it is better to get a blood test at a hospital first. Adult recommended daily iron intake to 10 mg for men and 14 mg for women. Pregnant women needs 20 to 24 milligrams, which is more. Zinc. Zinc enhances immunity, helps heal wounds, and synthesize proteins. However, excessive intake of zinc can rather suppress immune function. According to a study, people who consume 30 times the recommended amount of zinc decreased immune function due to abnormal lymphocyte stimulating responses, which are immune cells in the body. The daily recommended zinc intake is 7 to 10 mg. Overdosing on vitamins, although less common than deficiencies, is still possible and can have adverse effect on your health. It's important to note that most people can meet their vitamins needs through a balanced diet without the need for supplementation.